Alright class, so today we are looking at the muscles of the thorax and we are looking at the posterior superficial muscle. We will look at trapezius. Again, trapezius is the posterior very superficial muscle. The trapezius originates from the occipital bone, as you see here, originates from the occipital bone and upper cervical and thoracic vertebrae, so all these, and it inserts into the clavicle and scapula. The trapezius helps us to extend head and move the scapula. Again, for lecture you will be quizzed on origin, insertion and action of these muscles, and for lab you will just be asked to identify the muscle. Now the next muscle we will talk about is called latissimus dorsi. The latissimus dorsi is huge. It's a big muscle shown here in red. It originates from the lower vertebrae, lower lumbar vertebrae here, and iliac crest. That's where it originates, and it inserts into the intertubercular groove of the humerus. For testing purpose, just know humerus. So it inserts into the humerus. The latissimus dorsi is also known as hugging muscle, and it helps us to extend, adduct and medially rotate the arm, like hugging, right? When we hug someone, we extend, adduct and then medially rotate the arm. That's a function of latissimus dorsi. The next muscle we will talk about is supraspinatus. Now on the diagram in the left you see a scapula, and we are looking at the posterior side of scapula. We do see the spine leading to the acromion. Superior to the spine, the depression is called supraspinatus. It's called supraspinous fossa. Inferior to the spine, we have the depression called infraspinous fossa. Now, associated with the supraspinous fossa is the muscle called supraspinatus. It originates from the supraspinous fossa of the scapula and inserts into the humerus, as we can see. It abducts the humerus, meaning brings the humerus closer to the midline of the body. The next muscle is infraspinatus. This originates in the infraspinous fossa of scapula. It also inserts into the humerus and it helps to laterally rotate the humerus. Anteriorly, along the subscapular fossa, we have the subscapularis muscle. It also inserts into the humerus and it medially rotates the humerus. Then two other muscles in the back. Remember, these are actually deep to trapezius, and these muscles are called rhomboids. Now there are two rhomboids muscle. We have a rhomboid major and a rhomboid minor. And remember, these are deep to trapezius. So if you look at the diagram here, the left hand side is showing you the superficial trapezius muscle. If you reflect back the trapezius deep to that, you see the rhomboid major and the rhomboid minor. I want to highlight that rhomboid minor is superiorly located and rhomboid major is inferiorly located. And the names are major and minor because of the thickness of the muscle. Rhomboid major, although inferiorly located, this is a bigger muscle, so it's called major. And rhomboideus minor is, although superiorly located, it's called minor because this is a smaller muscle. Both of these rhomboids or rhomboideus muscles, they originate from the upper vertebrae and inserts into the medial border of the scapula. So originates from the upper vertebrae, inserts into the medial border of scapula. It helps us to retract our scapula. Next, there is a tiny muscle called teres major, which is shown by the black arrow here. Again, there are two teres muscles. We have a teres major and a teres minor. Major is inferiorly located and minor is superiorly located. Teres major originates from the inferior angle of scapula and also inserts into the humerus. It works together with latissimus dorsi, so it also functions as a hugging muscle. The next muscle we need to talk about is teres minor. It originates from the lateral border of scapula and inserts into the greater tubercle of the humerus. It helps in lateral rotation of the humerus. So remember that teres major and teres minor, they have different functions. Now there are four muscles: the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. These four muscles together, they are called rotator cuff muscles. And these four muscles, they actually provide strength and stability to the glenohumeral joint or to the shoulder joint. The rotator cuff muscles attach the scapula to the humerus. So these are the rotator cuff muscles, and we talked about the functions of the rotator cuff muscles very briefly. Okay, now moving on to some posture muscles at the back. They are called erector spinae muscles. There are three muscles. The first one is called iliocostalis, as you see here. And I'm moving lateral to medial. So most laterally we have iliocostalis. Medial to that we have longissimus. And the most medial one, which is very close to the spinal cord, that's called spinalis. So three muscles from lateral to medial: iliocostalis, longissimus, and spinalis. Together they are called erector spinae muscles. They remain contracted to help us maintain posture. When you are sitting in the lab or lecture, taking notes and listening to me, you are maintaining your posture, and that is because your erector spinae muscle are contracted to help you maintain posture. And I call these your I love spaghetti muscle. I for iliocostalis, L for love, S for spaghetti. So these are our I love spaghetti muscles. Together they are called erector spinae. They are the prime mover of the back and help us to extend our back. Moving on to anterior chest muscle, the most superficial one that we will talk about is called pectoralis major. Some of you have really well developed pectoralis major muscles. In females, we also have pectoralis major muscle, but remember that the female breasts sit on pectoralis major. So this muscle originates from the clavicle, sternum, and costal cartilages, and it inserts into the humerus. It helps to flex, adduct, and medially rotate the arm. These are functions of the pectoralis major muscle. Moving on to pec minor. The pectoralis minor is deep to pectoralis major. So you have to reflect the pec major to look at the pec minor. This originates from rib 3 to 5 as shown here. This is rib 3, 4, and 5. And it inserts into the coracoid process of scapula as shown here. It inserts into the coracoid process of scapula. It draws the scapula anteriorly and inferiorly. That's a function of pec minor. The next muscle is serratus anterior. They are called serratus because they have a jagged appearance like a serrated knife. These muscles originates from rib 1 through 8 as shown in the picture on the right hand side, and they insert into the medial border of scapula. They protract the scapula. Next, we have muscles of breathing, and these muscles are they help us to move the ribs while breathing. The first we will talk about is called external intercostals, as shown by, so these muscles right here, these are the external intercostals. And you just need to know the function of these muscles. They help to elevate the ribs for inspiration. As the ribs elevate, the space in the thoracic cavity is increased, thereby we can hold more air into the lungs. The next muscle set are the internal intercostals, and I will just label those here. These are the internal intercostals. They also help us in breathing, but they work opposite to the external intercostals, meaning they depress the ribs while expiration. Moving on to abdominal muscles, the first one that we will talk about is called external oblique. Remember, the external oblique is a very superficial muscle, and these muscles are actually very thin muscles. They do not have, their tendon is flattened, and their tendon looks very white and flattened, and we call that aponeurosis. Remember the term aponeurosis, that is nothing but a very flat tendon. When the tendon gets very flat, we call that aponeurosis, and we have aponeurosis associated with the flat muscles of the body. Okay, so very superficially, these muscles are called external oblique. They help us to flex and rotate the trunk. Deep to external oblique, we have internal oblique, and the fibers of internal oblique, they look different from the external oblique. If you look at external oblique, the fibers move down and medial. For internal oblique, the fibers are moving up and medially. This also helps in flexion and rotation of the trunk. The deepest layer is transverse abdominis, and the fibers run very transversely, as you can see. This helps to compress the abdomen. The six-pack muscle is called rectus abdominis. Again, some of you have very well developed rectus abdominis muscle. Mine is all fat. And the rectus abdominis helps to flex and also rotate the trunk. For these muscles, for the abdominal muscles, you just need to know the action. So just go by the PowerPoint. Now diaphragm, it's a prime mover of respiration. I'll just put here. Oh, it's actually written, sorry. Prime mover of respiration. It's a dome-shaped muscle, as you can see. And remember, the diaphragm is innervated by the phrenic nerve, which keeps us alive. And that's all about the chest and the back muscles.